Just wait for everyone to join. All right. Hello, everyone. Welcome to the North Hartford Promise Zone's COVID-19 The Facts. This event is going to be running from 6 to 7 p.m. today and is the second event of our winter virtual series. If you would like to join us at our upcoming virtual event, Emergency Housing Resources with Connecticut Fair Housing from 6 to 7 p.m. on February 25th, next Thursday, please be sure to fill out our Eventbrite invitation, which is going to be posted in the Zoom chat now. Also, please follow the North Hartford Promise Zone's Facebook, Twitter, and Instagram for more information on these events, as well as others, and the links to all of our social media are also going to be posted in the chat now as well. The North Hartford Promise Zone Winter Virtual Event Series is a follow-up to our Fall Virtual Event Series. If you missed those, please check out the NHPZ Facebook page for the recorded videos, and the link to those will be posted in the Zoom chat at the end of our event, and all relevant links will also be posted in the Facebook comments. Today, in partnership with the Department of Health and Human Services and Hartford Communities That Care, Inc., we are pleased to have community health workers Darlene Robertson-Childs, CJ Drayton, Winston Kennedy, and Morgan Cunley. If you have any questions for the speakers, feel free to ask in the chat or in the Facebook comments at any time, and we will be sure to address them during our Q&A session. Speakers, you can begin whenever you're ready.
Hello, everyone. My name is Darlene Childs. I'm the lead for the Hartford Communities That Care Community Health Workers. Tonight, you will be talking with, or who will be presenting to you tonight will be Clifton Drayton and Winston Kennedy. Unfortunately, I have to break away shortly, but I'm leaving you in very capable hands of those two gentlemen. They're two of our best people. They're good. They're very knowledgeable. They'll be talking to you about the basics of coronavirus. And another thing I would like to add, if you have any questions, could you just please write down the slide number and wait toward the end, for time's sake, ask the questions at the end of the presentation would be helpful. I appreciate you all. And again, thank you for inviting us out to speak with you tonight.
Yes, my name is Winston Kennedy. I am a community health worker. I work for Hartford Communities That Care. Again, we're going to give you some of the basic steps of the coronavirus and how to you to prevent yourself from catching this particular virus. As you see on your screen, this is a basic roadmap that we set up on how it spread, signs of infection, the symptoms, who is at risk, the 3 W's, the testing, contact tracing, and quarantine and isolation. Next slide, please. Next slide, please. What is COVID-19? Now, COVID-19 is the name of the illness that causes the SARS-CoV-2 virus. This SARS-CoV-2 virus is a coronavirus. What is a coronavirus? Do all coronaviruses cause COVID-19? They do not. There are many types of coronaviruses. They are common in people and in animals. Some coronaviruses causes minor illnesses such as the common cold, but this particular virus, COVID-19, is causes a more serious, illnesses, as we will see in the later slides. Next slide, please. Says how COVID-19 is spread. The coronavirus that causes COVID-19 is spread mainly in two ways. It is airborne. if you sneeze, cough, if you talk or sing, these tiny droplets will come out of your mouth containing the virus. You know, a lot of times we say to ourselves, we can't see them, we can't feel them coming out of our mouth. But if you were to ever sneeze and you did not have say, a handkerchief or a Kleenex, and you sneezed into your hand would automatically become wet. These are the droplets that we're talking about. Next slide, please. Also, if you sneeze, if you cough, or if you're singing, whatever, these same droplets, because they're airborne, they can land on this doorknob as you see. They could also land on your desk at work, on your table at home, any surface. And what happens is you turn around after someone else with the virus coughs or sneezes or talks, and you end up catching this virus. For example, you might be at work, you and your friend, y'all are cool. She leaves her desk or he leaves from the desk, and you ask if you could use their laptop, and all of a sudden they have the virus. They don't know it, you don't know it. You start working on that laptop, and all of a sudden you start touching your face, your mouth, your eyes. And this is something we do all the time, not even realizing that we're touching our faces, but we do. And what happens is that virus that they have, you have now. Next slide, please. How do we know if we are infected? People infected with COVID-19 might have systematic, no, or they are asymptomatic. Whether you're systematic or asymptomatic, an asymptomatic individual is an individual who can have the virus but have no symptoms whatsoever, but they still can spread the virus. And these symptoms can appear or won't appear really for 2 to 14 days after being exposed to the individual who you were around who had the virus. Next slide, please. Symptoms of COVID-19. Symptoms of COVID-19 may include fever or chills, cough, sore throat, shortness of breath, or difficulty breathing, fatigue, muscle or body aches, headaches, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Next slide, please. Now, if you take a look at this chart, it's the difference between a cold, the flu, and COVID-19. Now, we've all had the common cold, so we're experiencing, we know what happens when we have the chills or a fever, when we're experiencing a cough, a sore throat, especially a runny nose. But look at the other two. Look at the comparisons between the flu and COVID-19. Only difference is shortness of breath, difficulty breathing, or loss of taste or smell. So don't take it for granted, or don't think that only thing you have is the flu. Go get tested. And don't think, well, because I don't have shortness of breath, I don't have difficulty breathing, and I don't have loss of taste, that you don't have uh, COVID. Don't just look for those two symptoms to say, well, I'm okay. I have the flu. No, again, go get tested. Next slide, please. Who is at high risk for getting really sick with COVID? Older adults, senior citizens like myself, people with certain health conditions, pregnant women, racial and ethnic minorities. And that really puzzled me when I first saw this one, race, racial or ethnic minorities. And as we go on to the next slide, I'll explain why it really bothered me. Next slide, please. And this is why it bothers me, because when I look at the gap between white, black, and Hispanic, it totally blew my mind. And the reason I was saying to myself, well, why is this the case? And really, in the minority setting, we could work one, two, or three jobs, but neither job will give us or supply, say, insurance. So what happens is, or health insurance, I should say. So what happens is we don't have the opportunity or the luxury of going to the doctor twice a year or once a year to get a physical. So we're walking around with different symptoms, not knowing we have them. Whereas our white brothers and sisters, they have a job, they have health insurance, them and their family are able to go and get this physical so they know if they have a symptom or not. Next slide, please. And these are some of the symptoms that we're talking about. You don't have insurance, you don't know if you have cancer or not. You don't know if you have chronic kidney disease. You don't know if you have chronic obstruction pulmonary disease, heart disease. I can't pronounce it. Immunosuppressed by solid organ transplant, hypertension, overweight or obesity, liver disease, sickle cell anemia, smoke, type 1 or 2 diabetes, or asthma. So here it is. You're walking around because you don't have health insurance from your job. You're walking around with maybe one or two of these symptoms, and all of a sudden you catch the virus. And the reason we get, say, sick or we end up dead is because our bodies is no way it could fight off the virus in these other conditions that we just mentioned. Next slide, please. What about children? Go ahead. What it says, since March 2020, over 275,000 COVID cases in children have been reported. COVID-19 incidence among adolescents aged 12 to 17 years was approximately twice that in children ages 5 to 7 to 11 years. Symptoms may be mild or severe, still important to protect them. So when we were in the, just today we were talking about this particular slide, and we came up with the conclusion that, the reason that the 12 and 17 probably are more prompt to get this virus is because, they mingle together, they're going to different places together, different sporting events. So, and they're hanging out. Most of them at 17, 18 years old, they have a car. So, everybody's in the car, nobody has the mask on. And this is one of the reasons we figured that the rate for 12 to 17-year-olds were a lot higher. Next slide, please. How do we avoid COVID? Questions, how do we avoid getting COVID-19? Answer, practice the 3 W's. And it's wear masks, watch your distance, wash your hands. If you practice these 3, it'll help.
All right. So the first W is wearing a mask correctly. The top 3 is how you would want to wear a mask, and the bottom 3 are incorrect ways to wear masks. So obviously, you wouldn't want to wear a mask on your forehead. That's ineffective, and you also don't want to wear it in your chin, under your chin, because you're still able to spread those germs when you cough or sneeze. You also want to refrain from touching your mask, because then there could be germs on your mask, and then you're touching surfaces, and then that'll allow for other people to touch those same surfaces, and that could spread the germs. So the second W is to watch your distance. You want to stay at least 6 feet apart. So a good way of knowing that you are at least 6 feet apart are to put both your arms out, and that should be enough space. So the third W is to wash your hands. The first step of that would be to wet your hands, then apply soap and scrub for at least 20 seconds. You can maybe sing a song that lasts 20 seconds or longer. Then you want to rinse underwater and dry with a clean towel, and then your hands will be clean. So we want to get tested for COVID-19. It's easy, it's safe, and it's very important. The quicker you know, the faster that you'll be able to help stop the spread. So where can you get tested? You can get tested at federally qualified community health centers, mobile testing events, local hospitals, specifically the Arroyo Center at Pope Park. I believe that's a Rapid. You can find all this information on the Hartford 301 Facebook page. The link will be put into the chat. Do you have to pay for a COVID-19 test? If you don't have insurance, no, you do not have to pay. And even if you do have insurance, in most cases, you will not be charged. So if you're symptomatic, then your insurance will pay. The state of Connecticut is offering free testing events where the state will pay if your insurance does not cover it. So the insurance may still be collected, but you will not be charged a copay. So it's free of cost. So what the test is really like, most people who have had the test say it was a little uncomfortable, but it certainly does not hurt. Sometimes it may make your eyes water or cause you to sneeze, but it's not painful at all. Who should get tested? A person should get tested if any of the following is true. So if you have one or more symptoms, then you should get tested. If you have no symptoms, but we're in contact with someone who tested positive, in that case, you should wait 5 days to be tested, because the likelihood of you getting a false negative result if you don't wait those 5 days is a lot higher. So you want to wait 5 days to get tested after you were in contact with someone who tested positive. So you also should get tested if you live in a community where there's a lot of community spread. So after you get tested, you want to wait for your results at home if you are symptomatic, and also if you are asymptomatic, but are a known contact of someone who tested positive. You should wait for your results at home. So if you tested positive for COVID-19, what you want to do is isolate at home. Isolate meaning you stay at home until you are no longer infectious. The minimum time you isolate is you have to isolate for at least 10 days, but you may have to isolate longer if you're still sick after those 10 days or still showing symptoms after those 10 days. You may have to isolate longer. So once you test positive, a worker from your local city health department is going to call you You need to answer this call. They have questions for you that would be very helpful for you to answer in order to help us stop community spread. So when can you leave home after you test positive? So again, you want to wait until you are no longer infectious. The minimum time is going to be 10 days. So that means you have to isolate. And I want to emphasize that if you're still showing symptoms or sick after those 10 days, you still need to isolate. And if you never get symptoms, you want to isolate 10 days from the date of the positive test. How do you protect family members if you test positive? So you're gonna want to wear a mask indoors and also have your family wear a mask indoors. That's gonna help stop the spread of germs because you tend to have a lot closer contact with your family. So because of that, you want to also try to limit your interactions with these family members. And also you need to clean up after yourself when you use the bathroom or touch any objects. So maybe buy some wipes, disinfecting wipes, and that'll help. You also want to try to keep the windows open in your home so that the virus won't stay in the air if you sneeze. Airflow is very important. Also, you should stay in one room as much as you can during your 10-day isolation period. So quarantine versus isolation. Quarantine is a healthy person, and this is someone who has been exposed and they're staying at home away from others. They usually tend to wait until they get their COVID test result back. Isolation is when you know that you've contracted the virus, and or if you're sick, and even if you have mild symptoms, you're still isolated. So again, you need to stay at home and away from others. Support and resources for those with COVID-19. So what if it's hard for you or your family members to stay at home? There is help. There's resources available, including food pantry pickup and delivery, household supplies, masks and gloves, housing/rent assistance. There's help with utilities and also medicine delivery. So once again, you can dial 311 or visit that Hartford 311 Facebook page, and that'll have that information there. Thank you. I appreciate you attending this presentation. I hope that you've all gained a great amount of information. Once again, my name is Clifton Drayton. I work for Hartford Communities That Care. I'm a community health worker. Here's our information.
Thank you all so much for that really helpful presentation. Now we will move into a time of Q&A. So if any of you have questions for any of the people here, we will be taking those in the chat, both on the Facebook Live and here on the Zoom call. If you are comfortable as well, you may raise your hand and ask to be unmuted to ask your question. And we also have the privilege of having with us a registered nurse, Morgan Cunley, who will also be taking questions at this time. So the first question we have is, I know when the pandemic started, they didn't want people coming into the hospital right away. Is that still the case? And if so, when do you know when it's time to go to the hospital to get medical care?
Sure, yeah, so I can answer that question. And again, I'm Morgan. I'm a registered nurse. I'm working with the City of Hartford and the CDC Foundation. So definitely the hospital never will turn away anyone, but we definitely encourage that you seek an emergency setting if you have an emergent situation. Some of those symptoms look like difficulty breathing. If you have noticed you have bluish lips, severe shortness of breath would be some of the signs. But if you have more mild symptoms, say a cough, or if you notice that you're achy, we encourage you to stay at home because we don't want you to kind of possibly spread to other people who are waiting in the emergency room. But definitely, if you have any severe symptoms, we want you to call to be seen. We will always be there to help.
Great, thank you. Another question from somebody is it safe to travel if you do the 3 Ws, if you wash your hands, watch your distance, and wear a mask?
Yep, so officially, we would like to just recommend that all travel be minimized as much as possible. We definitely understand that necessary travel, say to the grocery store, to doctor's appointments, things like that are important and you'll need to travel. But we highly encourage you to just stay at home to try to minimize the spread as much as we can.
Thank you. Another question is, what if wearing a mask causes difficulty breathing? Should I still wear it?
Sure. So if you're having some difficulty breathing, we recommend to talk to your doctor. There are different types of masks too that might help, but we do try to encourage to wear a mask because again, that's that barrier from you kind of contaminating anyone else or having their spread get to you.
Thank you. We have a couple questions about the vaccine now. So the first question is, anything we need to know about the COVID vaccine that the general public might not know?
Yeah, oh, sorry, was someone else speaking?
I think that's it. Yeah.
Okay, so with the COVID vaccines, there are two main types out right now. One is called Pfizer and one is Moderna. So when it's your turn, we're kind of staggering the phases out. And when it is your turn to come and get your vaccine, you'll notice it'll be either Pfizer or Moderna right now. There are some others coming out. The differences between those two are just some of the lipid, which are fatty components within the vaccines. Pfizer, you'll come and get your second dose after 21 days, and Moderna will be 28 days for your second dose. So I can tell you some normal, like major, not major, but normal side effects would be just a little bit of arm tenderness in your arm, which we recommend just moving your arm around and wearing a cold compress. And some people feel tired on the first dose. With the second dose, people tend to have a little bit more symptoms, but generally still mild. Those would be body aches, fatigue, sometimes chills. That means though that your body has recognized what is happening. So it's recognizing that, oh, we don't want COVID and you're responding appropriately.
Good to know. Another question, if someone is vaccinated, will they still be able to transmit COVID-19?
Yes, so that is actually something really important to say. So even though you get your COVID vaccine, you can still transmit and are susceptible to COVID-19. Definitely, so people might ask, oh, why do I get the COVID vaccine? It's still super important because just like with any vaccine, so say the flu, if you were to get the flu or if you were to get COVID, since you're vaccinated, you're going to have a way less and more mild symptom management. So again, if you aren't vaccinated and you get COVID, your symptoms are going to be a lot worse. You could end up in the hospital. Whereas if you're vaccinated, it's much less likely that.
Thank you. That's some helpful information. I also have a question about why can't I put a disposable mask over a KN95? And I think that relates to what types of masks are best and what's recommended when it comes to wearing masks.
Yeah, so with the new variants, things are changing now and they're recommending using a normal just cloth mask with a surgical mask over. Sometimes, so the question is, why can't I put a disposable mask over a KN95? So the KN95s are different than disposable masks. Disposable masks protect against droplets. KN95s have a different porous material, so they cover just like an N95, closer contact, and they cover more airborne particles, whereas disposable is more for droplet. So we kind of call a KN95 or an N95 the gold standard of masks, but that's right now what a lot of healthcare workers are using just because they have such close contact.
That's helpful. If somebody gets COVID, will they be immune to getting it in the future?
So they have been finding that people can have COVID repeatedly. So that's why it's still so important to, like we said, follow the 3 Ws. So wash your hands, watch your distance, wear your mask. And you would still, again, in reference to the COVID vaccines, continue to do that too.
All right, I have another question about the vaccine. With the second dose of the vaccine, does it have to be exactly by the 21st or the 28th day, or just any time after that? What's the timeline like on that?
Yep, that's a good question. So yeah, with Pfizer, the 21 days again, and Moderna 28. And we recommend, we don't want anything before that, but after that. So say if you couldn't come in on that 28th day, you could come in on the 30th, but we definitely recommend around that time, just nothing before.
Great. Another question is, how do I lower my child's risk of getting COVID without the vaccine?
Yep, so again, that's kind of why it's so important to maintain social distancing, wearing a mask, washing your hand. And again, it's in reference to that travel question too. So really try to minimize your interactions with other people. So staying home. I know people are getting very creative with family game nights with themselves, and it's a good opportunity to bond with each other, get close. So we definitely recommend that, and limiting as much interaction as you can.
Thank you so much, Morgan. I'm going to wait just a little while to see if we get any more questions from the people here. I get another one. Is the vaccine that helpful? How helpful is the vaccine?
Yes, the vaccine is very helpful. So just like with all of our other flu vaccines, any other vaccine, we're trying to protect a lot of our patient populations, like elderly, who we talked about in the presentation, are more at risk. Minorities, like we've seen, more at risk. Sometimes people are finding that they don't have access to the vaccines. So we're protecting those populations, just like immunocompromised patients, so people who have cancer or on chemotherapy, because they would be not able to get the vaccine just then. So we're trying to protect those at risk, try to protect ourselves, our family, our friends. The more people who can get vaccinated, the greater herd immunity is what we call it. It's kind of a protection for everyone around you. So definitely very helpful. And hopefully, once we get everyone vaccinated, or the majority vaccinated, we can hopefully end this pandemic a little quicker.
That's good news. One more question about people with allergies. I guess we have one more after that. Allergies. If people have severe allergies, should they wait to get that vaccine? And do you know if there are specific allergies that are causing more people to have reactions than other allergens?
Yep, so with allergies, so we still recommend talking to your doctor, obviously, if you have a really severe allergy, but most of the time, even if you have an anaphylactic allergy, and that's a really bad allergy where your throat can swell up, you have a really hard time breathing, we would just monitor you for 30 minutes. And that's another point to bring up too. So with the COVID vaccines, We'll make sure that everyone is monitored regardless of their history for 15 minutes just to make sure you're feeling okay. But if you have that history of anaphylaxis, or another thing would be if you're on any blood thinners or anticoagulation, we would just watch you, monitor you for 30 minutes and make sure you're feeling okay. And then what was the second question again?
Yeah, we have a question about, is there any idea of when the pandemic will be over, or is that still up in the air?
So still up in the air. We're hoping that, like I said before, if we have a lot of people being vaccinated, that it will end sooner. We have been seeing some of the variants come through, but we're hoping that our vaccines will cover those as well. But still super important for the whole public to kind of come together and just keep washing your hands, keep social distancing. All of those are super important still, watching your distance. And then reach out if you have any questions. There are resources everywhere that can help you.
Great. We have two more questions, actually. They keep coming in. So the first is, with these new variants, are there different steps that we should be taking to protect ourselves from the virus?
Yep. So just like with everything, I know everyone is probably very tired of things changing all the time. But so far with the variant, they have recommended that people do a cloth mask and then a surgical mask. But everything as far as hand hygiene, social distancing, wearing your mask in general is still the same.
Okay. And then finally, how long does the virus live on clothes and surfaces? How careful do we need to be with cleaning everything?
Yep, so it differs based on we call it the porous of how porous the material is. So something that's more porous versus something that's less porous. So say if you have a cloth versus wood, it could stay on them for different amounts of time. So we want to it's kind of easier to just recommend that anytime you touch something, especially if you're on isolation or if you're quarantining and have no in contact with someone who has COVID, or if you have COVID yourself, just clean. Bleach kills. So we want you to use bleach, and just be, very careful with that.
Well, thank you so much, Morgan, for all of your knowledge and sharing it with us today. And also thank you to Winston and CJ and Darlene for giving a great presentation earlier. This has been a great night. This will be recorded and it will be found on the North Hartford Promise Zone Facebook page. And with that, I'm going to hand it back over to Anika to wrap us up.
All right, perfect. Thank you so much, Jenna. So that brings us to the end of our Q&A session for COVID-19, the facts. And those were some really great questions. I definitely learned a lot. Thank you so much, Morgan, for handling that Q&A session, as we had a rapid fire of questions coming in. And obviously, again, yes, thank you to CJ, Winston, and Darlene for the very informative presentation. So big thank you to all of our speakers for the helpful information today. We would love if you are further interested, please go look into the Department of Health and Human Services and Hartford Communities That Care for more information, as well as looking into the programs and services that they may provide. We would really want to hear from all of you watching, especially if you live in the North Hartford Promise Zone or are part of the Hartford community. So Jenna is going to be posting a link to our event survey in the Zoom chat and in the Facebook comments. And we ask that everybody please, please, please fill all of that out so we can put on more helpful resources and events just like this. And so we can learn how to serve the North Hartford Promise Zone better. Please feel free also to contact Jenna at jenna.vandontelar@hartford.gov. It was on the previous slide if you need to rewind, or if you need to check the comments or the chat. If you want to learn more about the services that the City of Hartford or Envision Center provides. And we look forward to seeing you at our next event, Emergency Housing Resources. Again, that is going to be Thursday, February 25th, same time, 6 to 7 p.m. So with that, thank you all for joining, and good night, everyone. Have a good night, and hopefully this was good information for you all out there. Please feel free to share the video with all of your friends, and hopefully we'll see you next week. Bye now.
Bye.
Thank you. Stay safe.